prescription for muscular fitness. As with the aerobic prescription, this is consistent with the American College of Sports Medicine guidelines, which aren't perfect, but they provide you with a good foundation for prescription that you'll build on in second and third year. Now, the prescription components for muscular fitness are slightly different. We have frequency, which is sessions per week. Intensity, well, that's relative to a max, which is 1 RM. There's only one max when we're talking about strength. Volume is sets and reps, so reps is number of times the weight is lifted consecutively, and sets is the number of times you'll do that. Exercises, well, how many, and are there any specific ones that you need to include for this prescription for this client? So exercise intensity is defined as a percentage of your 1 RM. Sometimes in textbooks and in the literature you'll see it defined as something like 8 RM or 10 RM, which means the maximum amount of weight that can be lifted 8 times or 10 times. It's important to keep intensity high, as all the evidence shows that lower intensity PRT isn't effective for health benefits like metabolic outcomes and psychological outcomes and bone density outcomes, that sort of thing. So case study 1 is Sky, 30-year-old stay-at-home mum of 2 and part-time sales assistant. Her goal is to tone up after having a baby 12 weeks ago. Currently walks 30 minutes 4 times a week, has no risk factors or chronic conditions. You have some max values there for her 1 RM leg press and chest press that you tested as part of a testing battery. You can see her blood pressure is normal and her BMI is normal. Now, the term tone up is something that you'll hear often in your career if you stay in the health and fitness industry. What it means to the client is that they want to see some visible muscle shape underneath their skin, basically, which in reality means having some amount of hypertrophy or muscle gain in conjunction with some weight loss. So therefore, the training prescription for toning up is basically a hypertrophy prescription. So Sky wants a program to improve her muscle tone, particularly in her upper arms. Prescription that you'll give her, well, frequency, according to the guidelines, 2 to 3 sessions per week. Intensity is 60 to 70% of 1 RM. This is a hypertrophy program for a beginner. So with her max values, you'll be able to determine that her leg press should be somewhere between 120 and 140 kilos as a training load. Her chest press will be 21 to 24.5 kilos. Her sets and reps, well, according to the guidelines, you can do either 1 set, 2 sets, or 3 sets of between 8 to 12 repetitions. How many sets she does and how many reps and how many sessions a week, that sort of thing, is going to be determined by factors other than what's in the guidelines. So how much time has your client got? What sort of availability have they got? Are they used to strength training? That sort of thing. Exercises, well, the guidelines say 8 to 10 exercises using all muscle groups. Case study 2 is Bruce, who's 37 years of age and wants to put on some muscle size after losing a lot of weight. So he put on weight after retiring from playing rugby, and he's now lost a lot through diet. He walks most nights, has no chronic illnesses or conditions. You have some max values for his leg press and bench press. You have his blood pressure and his BMI. Bruce wants a program to put on some muscle bulk. He's been strength training or weight training on his own for 12 weeks, doing what he remembers doing from when he was playing rugby. So what prescription would you write for Bruce? Training frequency, according to the guidelines, 2 to 3 sessions or exercise bouts per week. The intensity is 70 to 80% for Bruce because he's not a beginner. He's been training for 12 weeks and he also has a strong past history of strength training. His leg press would be 175 to 200 kilos, 52.5 to 60 kilos for the bench press. Once again, somewhere between 1 and 3 sets and 8 to 12 reps. Whether you choose 1 set or 2 sets or 3 sets is going to be determined by common sense judgment on what you think the client can handle, what the client's goals are, what his exercise history is, and that sort of thing. 8 to 10 exercises covering all muscle groups once again. Case study 3 is Belinda wants to join the Army Reserve and needs to be able to pass a certain physical performance test in order to get in, which is doing 8 push-ups and 45 sit-ups, as well as a cardiovascular test. She currently does aerobic type classes at the gym 4 times per week, sometimes gets a sore lower back, has no risk factors, chronic illnesses, etc. You test her for the push-up test and sit-up test because that relates to her goals. She can currently do 2 push-ups and 40 sit-ups. Her blood pressure is normal and her BMI is normal. Belinda needs a program that will enable her to pass her test in 12 weeks' time. Her prescription, well, the frequency is once again 2 to 3 sessions per week. Intensity for a beginner is 60 to 70% of 1 RM. Her sets and reps, once again, somewhere between 1 and 3 sets of 8 to 12 repetitions because we need to improve her strength here. And the exercises, 8 to 10, all muscle groups. But we need to consider specificity in this case. She needs to pass a push-up test and a sit-up test. So we must include push-ups and sit-ups somehow. And how we do this is going to be up to you. And during the seminar we discuss different methods of including push-ups and sit-ups into an exercise prescription so that it's still complied with our intensity, number of reps, number of sets. I recommend you revise your lecture notes relating to prescription for muscular fitness, having a look at those guidelines, as well as applying that in a case study sort of manner as they'll be examined in that way during the finals.